Hi everyone, it's me. So, if you like my channel, please like and subscribe. There's a notifications bell down at the corner that will notify you as to when I'm going live. And today I'm going to talk about an important subject, which is self advocacy. In other words, being an advocate for yourself. And I want to just a quick recap. I've been sick for a minute. I have chronic illnesses, but outside of that, I ended up getting really, really sick, and it's been going on for like a little over a month now. And I had swollen lymph nodes throughout, and ended up in the emergency room at one point because it was literally choking me. And that was actually 2 weeks after I saw the doctor, or something like that. But anyhow, I after the emergency room said that strep came back negative, mono came back negative, all of that, I just was like, okay, I don't know what to do. Then I thought about it, and I had an appointment with my rheumatologist coming up. And she is straight up one of my best doctors. She is absolutely phenomenal. And I knew that if something needs to get figured out, she's got that. She will figure it out. So I kept that appointment and went in, and we were going through all the symptoms. And there's a lot of concern because the medication I take makes me immunosuppressed. And so I was having rashes pop up. I was swollen lymph nodes. It's been rocking. My whole body was in a flare. So I go, and we're talking about it, and we're talking about the tests that we need to do to figure out what it is. And I said, I just don't get it. So all the tests from the emergency room just came back fine. And she goes, well, you know what? Let me check. And we went through, and turns out that I have Group A Strep, and it did not present in normal ways. So it ended up being a body-wide thing. And here's where it gets really touchy. The lab from the emergency room, when they sent it in, did not notify anyone that I was positive for Group A Strep. And so it was allowed to continue until I went to my rheumatologist. Now, I could have gone into primary care, but they couldn't figure it out already. So I didn't know, like, what am I going to do there? So I waited till I could see a doctor that I know really is I trust her. I trust her opinions. Um, Hi, CBT. I'm getting better. So we looked at that, and it turns out the lab did not notify anyone. So I've had this for a while, and it's been getting worse and worse. And I have been so tired and fatigued. And in my life, that leads to a lot of guilt because I am always trying to be out there doing whatever I can, doing outreach, going to whatever I can do, going to meetings, going, taking webinar, or whatever I can do. And then when I feel like I'm hitting a wall, it makes me feel really guilty. And especially because I do have to say that being a consultant, outreach worker, community liaison, that a lot of times I hear, things like nobody's doing anything. And it's really frustrating to those of us that are doing something. And it feels like you can just never do enough. And it's lately, it's been really getting me down because it's very hard to listen to no one's doing anything or screw the system when you are trying to shape the system. There are changes being made that me and other people have worked for. And it's really nice to see that there is being this, positive effect. But the problem is that it's already built up such a distrust of everything that even if someone knows what, you know, some of the nonprofits do, it still feels like because of the scope of the problem that no one's doing anything. And I have to say, the problem is getting worse, but the problem is more and more people are being unhoused. And we have the resources to fix it, but for some reason we're letting this turn into the humanitarian crisis that it is. Hi, Evelyn. Oh, thank you. Um, so I wanted to talk about, being a self advocate. And for me, what that means is when I go into health is the most important thing. I can do zero for anybody else if I'm not healthy. And so that meant to be an advocate for myself, I had to make sure that I went in. I had to make sure to tell my doctor there is something not right. I had to push past and say, okay, well, this doctor obviously is not going to figure this out, and that's okay. Not everybody knows everything and not everyone's perfect. And I get that. I probably will be switching primary care. Um, but I knew I had an appointment with a specialist coming up that is an amazing, amazing doctor. And so I was like, okay. So when I went in, I listed the symptoms. I made sure to take pictures of the rashes, when they were popping up, you know, things that I could give her as to clues as to what was going on. And, of course, you can feel the lymph nodes and stuff. Yeah, CBT, health is, yeah, it has to be. Because I really, even this weekend, like the pharmacy mess, and that's why I haven't blogged in a while. Um, the pharmacy messed up on my meds. And I don't think that they understood how serious that is for me. I am, on antidepressants and antipsychotics. And it isn't like you can stop taking them and not have horrible withdrawal symptoms. And there was nothing I could do. There was absolutely zero that I could do about it, except for say, I've had to deal with you guys doing this quite often, and I'm going to switch to a different pharmacy. Thank you for your service. And immediately switched pharmacies to one that is actually really great. They had it ready, they were pleasant. I was really impressed with the service. So that's another thing, being an advocate, understanding that, you know, not every and not you're not I'm not going to click with every say pharmacy, or I'm not going to click with a certain doctor, but that's when I understand and say, okay, well, how can I go about still advocating for my health? However, I do have to say that I was feeling not just guilt, but just like really depressed about, the fatigue I was experiencing. And on a personal level, I don't like to be down. Sorry, I didn't mean to just snort. I don't like to be down. And, you know, after finding out that, after we found out what all the symptoms were doing, strep when not diagnosed will go through your entire body. And so my body was responding to that. And now that we got it fixed, of course, I'm on antibiotics. And that right there, making sure that if I didn't feel right and making sure that, the test results were red, that's being an advocate. And it's okay. It's okay to switch a doctor if you feel that the care is not good. Don't wait until you're so angry that it builds a distrust in the whole medical profession. Because I do have to say, having a trauma informed medical staff and having integrative care has literally saved my life. And I have to give credit where it's due. And that happens to be, the medical care I was provided at Harborview. And like when I was younger, running into some, really amazing professionals. Um, I should CBT. I should be feeling better here really shortly. I am now. On my second antibiotic, and so I'm already feeling a little less swollen. But it's funny about the diagnosis because all of a sudden we figured it out. We were like, yeah, we know what's wrong. We don't have to have any invasive tests or anything like that. We were just like, we got that. We caught it. And it was strange because I got home and I sat down and I'm like, it's okay to rest. I know that I need rest now. I know that it's not just I have to push, push, push through it. Okay, there's really a severe infection going on. I can take some downtime. So today I have repotted some plants. I have a good little garden growing, which I love. I love. I love. And when I get little bits of energy, I get up and cook a little bit. And I've got spicy plum jelly on right now because I have a pepper plant. So I'm kind of experimenting with some different flavors, but I think it'll be delicious. So I just wanted to talk about that. And I think that that goes for anything, not just healthcare, but, really don't hit just one barrier and give up. Sometimes it takes a little while to get things to where they should be and trust that you know your body. If something is wrong, then, push for testing. I think that there's an issue with well, okay, I don't think. I know there's an issue with our healthcare system. And for those of you who have zero health insurance and those of you who have to pay insane premiums and all of that, you know, I just that causes death. And it's really hard to wrap my head around how we can still think that a for-profit healthcare system is okay. I don't understand it. I really don't. Because yeah, I had to go through a lot. Okay. I had to go to Seattle and live under a bridge and all of that and make sure I made those medical appointments and make sure that I, had people reminding me to take my meds, things like that, you know, but in doing that, it saved my life. Like healthcare, getting appropriate trauma informed healthcare is amazing, and especially when you have co-occurring illnesses, because it also helps you understand if you've got a good doctor, they'll talk to you about, all the different issues that come with certain conditions. And, I've learned a lot about things that I didn't know about. And it sparked me to learn more and more about anatomy and science and technology and healthcare. It's awesome, but whatever. Um, CBT, doing the things that make you happy are vital to your health too. I agree. I totally agree. And if you see the painting behind me, um, I did that I decided to hang up. I really like it. And, painting's one of those things that I really enjoy. And it is getting to like I have a hard time in fall and winter. I'm really temperature sensitive and cold really bothers me. So it is getting towards like fall. And that is where like I'll start making like blankets and doggy blankets for Laura and, you know, taking stuff for sleeping bags, things like that. But one thing that we did discuss is that I am immunosuppressed. And so I have to start being way more careful when I'm working with people that are ill. And so I'm going to work that out in my head to do, to watch for my own safety and still be able to contribute. One thing that I did want to bring up is that one thing I did want to bring up is that the fentanyl testing strips that I have on the list are vital. And we came across um, we came across an individual that really made us see that there's a lot of internal dialogue going along with that, and ODing. And it's the message I got was that they are life saving and vital, and it's opening up dialogue about saving lives and harm reduction. So, um, anyhow, if you want to support, and remember too that Amazon wish list, yes, it has personal stuff in there, but I have it to where the personal is of the lowest priority. Okay. The outreach stuff is listed as the highest. So, and there is notations on it as to whether it's personal or if it's for outreach. But the fentanyl testing strips are just imperative. So, if you can, donate it all to that, that would be absolutely awesome. And so that the PayPal and my Patreon are all in the description. And thank you, CBT. I love the way it turned out. And I'm actually like, I don't know. I love painting. I love photography. I just love art. I like expressing myself creatively. And it's really important for me to do that. Um, so anyhow, are there any questions, any comments, anything anybody wants to say? I'll give it a few seconds. No? Okay. Well, here's what I want to tell you. Please take care of yourselves. We need kind, compassionate, empathetic people out there. And that means that we need healthy, kind, compassionate, empathetic people, because we really need to heal our world. And we can do that by striving to be better, and by taking care of ourselves as well. And I'm not talking about taking care, sometimes pampering is great. I get that. But sometimes self-care just means calming your nerves and sitting down and breathing. Sometimes that right there is self-care. If you don't have anything to pamper yourself with, that's fine. Drink lots of water. Read something profound. Draw. But anyhow, I'm sending tons of love to you all. Um, Thank you, CBT. I appreciate that. Sending love to you all, and I hope you all have an amazing day. And I'm sure to be feeling much, much better here. And I'm excited about that. So I'm sure I'll be doing some more vlogs. I will talk to y'all later. Have a great day. Bye.